Page 2 of the NRCME Exam Walkthrough Audio Companion. We were talking about the 4 non-discretionary standards. We already discussed vision. The other 3 are hearing, diabetes, and epilepsy. Let's talk about hearing. 5-foot force whisper test or audiometric testing are acceptable for the hearing exam. If you're doing audiometric testing, you want greater than 40, that's 40 decibels at 500, 1000, and 2000 hertz, regardless of hearing aid use. So force whisper test or audiometric testing can be done regardless of hearing aid use. If the driver uses hearing aids, it is recommended that they carry a spare battery for their hearing aids while driving. At least one ear must pass. You do the alternative test. You do the alternate test if the patient fails the first test. So if they fail the whisper test, you do audiometric testing. If they fail audiometric testing, you do the whisper test. The math for this is a little bit confusing. I recommend looking at it in a written format and not just listening to it. You record loss in decibels for each hertz. So subtract 14 decibels for 500 hertz, subtract 10 decibels for 1000 hertz, and subtract 8.5 decibels for 2000 hertz. Add the 3 readings and divide by 3 for the average, which must be greater than 40 decibels, 40 decibels. Now, an audiologist may perform hearing tests for drivers with hearing aids. Let's talk about the 3rd non-discretionary standard, diabetes. Diabetes requiring insulin is disqualification, but a diabetic exemption can be an option for this driver. Just like monocular vision, there's a federal exemption for diabetes. Diabetics have been involved in 2 times more motor vehicle accidents than non-diabetic drivers. Diabetics always require an annual medical and eye exam. Annual medical and eye exam for diabetics. The detection of hypoglycemia is more relevant to safety considerations. So not hyperglycemia as much as hypo or low blood sugar is a concern when we're talking about safety. Hypoglycemia reaction is one that results in seizure, loss of consciousness, need of assistance from another person, or a period of impaired cognitive function without warning. The first sign of nephropathy is persistent proteinuria, so maximum certification of 2 years if stable, and that won't endanger safety. Diabetes gets a maximum certification of 2 years, though because of the progressive nature of diabetes, the FMCSA believes that 1 year maximum certification is reasonable. So technically you can give 2 years, but it's recommended, highly recommended, just to stick with 1 maximum certification, 1 year. The hemoglobin A1C greater than 10%. For more information about the other products we provide regarding the DOT exam, in other words, the NRCME, please go to our website and purchase our products there. Thank you for your support.